What would you do if a loved one suddenly clutched his chest, collapsed, and his heart stopped beating after just a few minutes? That is exactly the tragedy that happened to Mr. John's family. What is even more painful is that the warning signs, such as shortness of breath, swollen legs, fatigue, appeared before, but no one realized their danger. Don't think that this will not happen to your family. For every 4 people who die from heart disease, 1 person has no obvious signs. This video is a warning for all of us. I will share 6 emergency signs that signal an impending heart attack. Knowing 1 minute early can save a life. Don't miss Isagian. 1. Shortness of breath. The heart's silent cry for LCOP, shortness of breath, is one of the earliest, but most easily overlooked signs when the heart begins to weaken. Many people often think that shortness of breath is only related to the lungs or due to age. But in fact, when the heart is no longer strong enough to pump blood throughout the body, the organs will not be supplied with enough oxygen, and at this time, the lungs will have to work harder to compensate. That is why some people only need to walk a few steps of stairs to gasp for breath. Lying down does not feel comfortable, even having to use a high pillow to breathe. This is not normal fatigue, but a clear sign of heart failure, especially at night. When lying down, more blood is stagnant in the lungs, causing the patient to feel suffocated, having to sit up to breathe at night. This is one of the dangerous symptoms, signaling that the cardiovascular condition is deteriorating. If you or a loved one has prolonged shortness of breath, especially accompanied by fatigue and palpitations, you need to go to a medical facility immediately. Because many cases of late hospitalization have fallen into severe heart failure without even knowing it. Signs 2. Chest pain when the heart is squeezed from the inside. This is a sign that no one should take lightly. Chest pain often comes suddenly, maybe while you are walking, climbing stairs, or even resting. It feels like there is a heavy object pressing on the middle of the chest, spreading to the neck, shoulder, or left arm. Many people also describe it as being squeezed, burning in the middle of the chest, shortness of breath, and cold sweats. This is a typical manifestation of myocardial ischemia, and the biggest risk is myocardial infarction, a condition in which the coronary arteries are completely blocked, causing myocardial necrosis and can lead to death within minutes if not treated promptly. A common mistake is to think that chest pain is simply due to bloating, acid reflux, or fatigue, and then miss the golden opportunity to save your life or that of a loved one. If the pain lasts more than 5 minutes or recurs several times a day, do not wait. Call an ambulance immediately. Signs 3. Fainting when heart rate becomes dangeroso. You are standing and talking, then suddenly a person in front of you collapses to the floor. No impact, no previous signs. That is a fainting spell, an extremely dangerous sign, which can originate from a serious heart rhythm disorder or sudden cerebral ischemia. Due to the heart not pumping enough blood, fainting may only last a few seconds. But sometimes it is a warning of sudden death, especially if the patient has a history of high blood pressure, cardiovascular disease, or has fainted before without a clear cause. First aid in the first few minutes is extremely important. Lay the patient on his side, loosen the collar, check his breathing, and call for help immediately. If you have an AED, automatic defibrillator, use it as directed because the possibility of cardiac arrest is very high. Do not ignore any fainting spells, especially when accompanied by chest pain, shortness of breath, or cyanosis. The heart may have warned you, and it is your last chance. Sign 4. Leg edema is not returned by the HEAR. One morning you wake up, realize your feet are heavy, your ankles are swollen, and your shoes do not fit like usual. This could be a sign of edema due to right heart failure, when blood is not pumped back to the heart effectively, causing fluid to accumulate in the lower limbs. The obvious signs: pressing on the ankle or instep, feeling a deep depression, and slow recovery. This is not normal edema, but due to the heart being overloaded. Many people easily confuse it with edema due to the kidneys, liver, or simply due to walking a lot. But leg edema due to the heart tends to be worse in the evening. Both legs swell evenly and is often accompanied by shortness of breath and prolonged fatigue. If you see signs of leg edema of unknown cause, check your heart immediately. The heart may be stuck in the process of returning blood, and that's when you need to act early. Sign 5. Blue. When the body nitrogen monoxide longer receives enough oxygen, lips and fingertips turning blue is a sign that the blood is not carrying enough oxygen to the tissues. In many cases, this is the result of severe heart failure, when the circulating blood flow is no longer enough to nourish the vital organs. The elderly, infants, or patients with underlying heart and lung diseases are prone to cyanosis. In particular, if cyanosis appears suddenly, accompanied by difficulty breathing, lethargy, or coma, it is an emergency. Cyanosis is not simply a skin manifestation. It shows that the entire circulatory system is severely impaired. In many cases, it is the last sign before the heart stops beating. If you detect any area of skin, lips, or extremities turning purple or unusually cold, do not hesitate. Take them to the hospital immediately. Sign 6. Intermittent pain, leg. Pain after walking a few steps. This is a symptom that few people think is related to the cardiovascular system, but it is a clear warning of peripheral vascular disease. You walk a few hundred meters and your calves ache. You have to stop and rest for a while before continuing. Like that, every time you walk, there is pain. This is a manifestation of intermittent claudication, a condition in which blood does not circulate well to the lower limbs, causing a lack of oxygen to the muscles and causing pain. In essence, this is similar to a blockage of small arteries in the legs, but it is also a warning sign that the coronary arteries and cerebral arteries may be suffering from atherosclerosis. Not only the legs, but your cardiovascular system may be completely blocked. If not treated promptly, the patient may face limb necrosis, amputation, or the risk of stroke and myocardial infarction. Do not ignore the feeling of unusual leg pain when walking. Go for a cardiovascular examination to promptly prevent more serious complications. Finally, a message from the heart to you. Sometimes, the heart does not speak with a beat, but with very small signs. A fleeting shortness of breath, swollen legs every afternoon, or a feeling of heaviness in the chest for just a few minutes. We often think it's okay, but those signs, if listened to early, can be an opportunity to save a loved one's life or yourself. Remember the 6 signs today: unusual shortness of breath, chest pain as if pressed by something, sudden fainting for no apparent reason, leg swelling, especially at the end of the day, cyanosis of the lips, extremities, pain after walking a few steps is leg pain. All are urgent warning signals from the heart. And in cardiovascular medicine, time is life. The sooner you act, the higher the chance of recovery. If you find this video useful, please share it with your relatives and friends, especially those over 50 years old. A small action from you can help someone recognize the problem and be saved in time. And don't forget to subscribe to the channel so you don't miss the latest videos on heart, brain, liver, and kidney health, and simple medical knowledge that everyone should know, because health is not something you can only cherish when you lose it. Let your heart be loved in the right way, at the right time, and by the right person.